I am Muthuvel. I am working in radiotherapy department, working as a chief medical physicist cum radiological safety officer. In VPS Lakeshore, we are conducting the patient safety program on coming September 17th, engaging patients for patient safety. That is our goal. In our VPS Lakeshore Hospital, we have 3 radiation-related departments. One is diagnostic radiology, another one is radiotherapy technology, radiotherapy department, as well as nuclear medicine department. Radiations, it is harmful or hazardous to the patients as well as the employee who are working there. In all the three departments, we have dedicated and quality teams, or the qualified workers are there. It is common for all the 3 departments. The patients, when we are receiving, they have uniform safety programs was there. First of all, when the patients coming for the diagnostic radiology, any accidental situation or normal IP patients or OP patients, when they come for the radiograph or X-ray or CT scan or interventional radiology procedure, anything, they will come to the team, they will discuss with our doctors. The radiographer will check the list, what are the things he has to do. For the patient concerns, if they have the proper area or has to be radiograph or X-ray or CT, the positioning is more important. For that, we will use all the immobilization division, positioning radiography, all the supporting system also we are providing. And another thing is for the patient, which area going to be take the projected or the field size or imaging factors, we are giving correct factors, exposure factor we will give to reduce the radiation dose to the patient and minimize the radiation exposure. We will ask the patients any allergic reaction or contrast media, any medications you are taking. According to that, to get the advice from the doctors, they will be giving for that. And any female patients, if they are pregnant or breastfeeding is giving, we will ask them to get the medications advice from the radiologist or doctors. Then only we will give the procedure for that. And any diabetic patients also, so we will do for that. Immediately we are taking the care of the diabetes, special care for the diabetic patients. Then they have the radiation detectors also. And when you after the procedure, we will give this all the measurement, any quality of the equipments, any leakage, radiations there, we will measure the radiation detectors. And these equipments are kept in the dedicated rooms. It is to the safety aside. Radiation should not leak out from the outside the room. It is planned and is approved by the Atomic Energy Regulatory Board and ICRP 103. This WHO's instructions and the Indian Regulatory Board will advise the specific approved plan. Those area only all the equipments will be installed. Nuclear medicine, we have PET CT scan as well as SPECT CT scan. PET CT scan, positron emission tomography, as well as SPECT, single photon emission tomography. Also the well advanced PET scan we have. This is Discovery IQ as well as SPECT also we have, gamma camera we have. As well as high dose iodine therapy also we are giving in our full-fledged nuclear medicine department, we are giving to the patients. In that we are giving for the radioactive traces are injected to the patient. That is the nominal level only. Before the patient will come, we are giving the instruction to should not take the diet for before taking the process 6 hours. These traces, what are advantages to diagnose the disease as well as we can take for the treatment also. And here it is diagnosis purpose when you do these radioactive traces, when you inject by IV line, and these traces will accumulate in the affected area like a thyroid or the liver or organs. When we are with bone, wherever it is located, that will be accumulated in the radioactive medicines. This will emit the radiations, that is like gamma rays. This will be detected by the PET scan machine. It will give the images. According to that, we can diagnose the disease, how much the active normal function of the organ we can be diagnosed. That is the real procedure. But the patient concern after this, what to do? For that, when we are receiving the radioactive medicines inside the body, we will give the instruction to drink more water, and any other relatives like male or female, they are keep little distance for 1 day, 24 hours period. There is just 3 feet distance is needed, because the mild dose may be their urinary as well as blood, it will be available. Therefore, to keep some distance, that is enough for the after the procedure. Before leaving the patient, we are measuring with the radiation detectors to analyze the body. That is how much radiation is coming out from the body. That is all the things within acceptable limit, permissible limit. We will measure the radiation level and we will notice that. After that only we will discharge. Similarly, we are doing for the high dose therapy also. High dose therapy, we will be staying the patient in the ideal isolated room only. We are giving injected to them. They will give the special instruction given by the radiologist and the nuclear medicine radiologist and the nuclear medicine technologist. We are giving for the advice for them. After 1 day or 24 hours, the patient can be discharged to proper screening and detectors. We are measuring the radiation level. We will ask them to drink more water for that to excrete the radioactive traces. In case the patient having admitted inside the room, in case there will be urinary or the traces like any vomiting they have done, the special spillage procedure will be followed, and we will be taking that all the cloth we will use to wear the gloves and remove all the waste and keep the proper waste management disposal container, and the procedure for we are following the waste management system in the government as per the government rule. After 1 day they can use the normal toilet they can use for this is the advice we are giving for the patient in the nuclear medicine side. For radiotherapy concerns, it is higher energy radiations or we are using. It is a mega voltage X-rays were used for radiotherapy treatment. For cancer patients, we are treating for the radiotherapy purpose. Same thing we are using for radiotherapy. There are two things normally used: teletherapy as well as brachytherapy. Teletherapy machine is we have two linear accelerator machine, Versa HD, and two well advanced machines we have. There are two machines, similar parameters. In case of any machine errors, machine problem will come, we will shift the patient to the next machine. Therefore, the patient will not suffer anyway. We will give the full-fledged treatment, and dedicated team is operating the both machines, as well as brachytherapy, high-dose brachytherapy machines also we have. That is, we are giving internal radiation therapy for gynecological cancers. We are giving for that, using iridium-192 radioactive sources. We are using immobilization device like there is a mold material like thermoplastic material. The specific or special mold we are using for that. In this mold only we are taking the patient to the CT scan and plan for different slices. We are taking for the proper area, which area is the tumor areas there. We are taking different slices. The dedicated physicist team will plan how to give radiation, which angle we give the radiation. Once the plan is succeeded, the adequate radiation dose to the proper tumor and minimize the radiation dose to the surrounding normal tissue. That way we will plan for that. Once it is planning is over, the patient will be transferred to the LINAC machine, and which we can deliver for the radiation for normally 30 days or 33 days we are giving for that. It's a fractionated radiation therapy we are giving for that, for the radical cases. In case of palliative cases, we are giving for the 10 days per fractions we will be giving for the treatment. For the patient concern, we are giving proper advice. It will not be spread, it will not be leak, and if the patient should not move during the radiation time, and we will give the proper instructions and the advice we are giving. After the treatment also, the patient will come out from the room. There is no radiation in the patient body. We are detecting or we are measuring for that. All the rooms, in the radioactive rooms, we have warning lights. There is red and green lights also there, and the instruction placard will see pasted on all the radiation rooms to see they can keep away from the rooms. There we are giving the proper advice of pregnant ladies as well as childs should not enter the restricted area. We are giving the proper advice for them. Similarly, brachytherapy also, the gynecological patients will come. We are giving for the iridium-192 radioactive source. We are keeping inside the patient body by a special procedure with the help of good anesthetic team. With our radiation oncologist will do the procedure. Once the procedure is over, after that we will do the CT scan and well dedicated planning. After that we give the radicators radiation dose to deliver. Only hardly 10 to 15 minutes the whole treatment will be over. After that, when you remove the applicator, we will use the radiation detector machine to survey that there is no radiation inside the body. We will confirm that then only we are discharging the patient that is there in the radiotherapy department. All things we are giving more care and safety of the patients. All the dedicated staff will be hold the patient and treat the patient politely, gently, and advise them properly about the radiation hazards as well as protection and their safety also we are ensured with them. Normally the radiation basic principle, time distance shielding we will be selling radiation protection point of view. There is the international standard that is called minimum time you got to use the radiation and maximum distance you have to keep and adequate shielding. Therefore, all the radiation rooms kept in the adequate special constructed room will be there, the adequate shielding also there. We will follow the principle of ALARA as low as reasonably achievable radiation dose. ALARA principle, we are internationally following that principle. We are keeping all the 3 departments